Hello again, El Paso. This is Dr. Kimball with Westside Dentistry, and I'm just finishing up work today, and I wanted to go over a few questions that we received today and most days. And I have a few models here to go over a few different options for replacing teeth when they're missing. So sometimes teeth need to be extracted, and sometimes people have been missing teeth for a long time. In fact, some of the statistics say that 178 million Americans are missing at least one tooth, and about 40 million Americans are missing all of their teeth. And so we'll talk a little bit about the different options for both of those scenarios today. So first of all, I've got this big model here, and when you're missing a tooth, one option is a dental implant. And so a dental implant is made of titanium, and it replaces the root of the tooth. So if you have enough bone to be able to place the implant, that can be done in one day, and we typically wait about 4 months before we can go ahead and place the second part, which is the crown and the abutment. So in the meantime, while you're waiting, you typically won't see this abutment on there. There'll still just be a space there. And if it's a place that in the aesthetic zone or somewhere in the front where you can see, and you don't want to go without a tooth for that long, then there are other options. We can do a little partial denture that just replaces one tooth that you can take in and out of your mouth during that time. So that's an option for replacing one tooth, and of course it could be multiple teeth as well. So another option for replacing multiple teeth would be if you were not able to get dental implants or did not want to. This person's missing all of their back teeth on the upper left and then a tooth here. So a partial denture can be made, and partial dentures can be made of a few different materials, but this type of partial denture does not have any metal in it. It's flexible, and it has pink clasps that match the gum tissue. So what happens, you need to have a few teeth to be able to clasp onto, and so a partial denture works like this. It just pops on, goes around the teeth, like so. So partial dentures are good. They're not as strong and not as comfortable as dental implants, but it's still a good option for replacing teeth. So when you have to get all of your teeth taken out, or you've lost all your teeth, or you've been in a full denture for a long time, a denture looks like this. It replaces all of the teeth. This is a maxillary denture, a denture for the top teeth, the top. And this one is an example of a lower denture. Okay. So the models that I have today are actually of something we call an overdenture. So people with dentures, most people with dentures don't have implants, but one of the benefits of placing implants with your denture is that it keeps the denture stable, and so it doesn't move around a lot or at all. So one of the main complaints that people have with dentures is that they can't eat what they want to eat, because when they chew on tough things or hard things, it can be dislodged or it can be unstable, and they don't have the chewing power that they have with implants or their normal teeth. So sometimes to make a denture stable, they'll use a type of adhesive or glue in the denture to get it to stay. But that can become messy and tiresome of having to clean that out regularly. So one great option is to actually place, this is of the upper jaw, and we can actually place a number of implants. In this case, it's 4 implants. You can place 4 implants on the top or 4 implants on the bottom, and you can actually modify the upper denture or the lower denture to be able to snap in the denture. So you don't need any adhesive or glue, and it stays on pretty good. So it's a lot more stable, and there's different tightnesses that we can make it. There's different retention strengths. So, and that's determined by different inserts that we put in. So patients really like this option, especially if they already have a denture. All we have to do is place the implants and wait a few months before we can go ahead and modify the denture that they currently have, or we can make a new denture and be able to snap that in. So this is of course an example for the upper teeth, and we have another example here for the lower teeth. Now, having a snap-in denture or an overdenture is especially beneficial for the lower teeth, because the lower teeth does not have a palate, so there's a lot less suction and stability for a lower denture. And a lot of people that have lower dentures also have lost a lot of bone in that area, so the dentures a lot of times are not very stable on the lower without implants, and especially because your tongue is there and your tongue's moving around and causing the lower denture to become dislodged as well. So placing some implants on the lower can be very beneficial as well, and it's pretty much the same thing. They'll snap in and they're on there really well. So it's a really good option for people that already have dentures or that need dentures. So and so this is a model of a denture that only has 2 implants. So 2 implants are good. 2 implants on the bottom are much better than having no implants on the bottom, but having 4 implants on the bottom is even a lot better than that. So let's see. So then there's one more option of if you didn't want to be able to take it in and out, and you wanted it to just be permanent. There's the option of doing bridges. So you place more implants on the lower or the upper jaw, and we can make bridge work, crowns that go on those, or we can do something like a permanent denture that screws in and it doesn't come out. And one name for that could be like an all-on-4 type denture or a hybrid denture. So we do those as well. So there's a lot of different options for replacing teeth, and if you would like to learn more about it, or if you know somebody that could benefit from these options, we would love to see you as a patient. Again, my name is Dr. Kimball, and my office is Westside Dentistry, 7181 Westwind Drive, Suite A. And our phone number is 915-581-1511. And our website is www.westside-dentistry.com. We'd love to hear from you. Thank you.